What are we on? COVID.
COVID stuff.
COVID is over.
So this week, the whole discussion was, I mean, not the discussion, but the head of the WHO came out and finally said, oh, we're in a pandemic still, which was kind of big news. Do you think this would be something you'd tell people about before Christmas and New Year's?
I mean, this was New Year. This was Christmas.
Yeah.
Transmission on Christmas Day, almost 95% higher than the entire pandemic. Or sorry, that's not what I mean. It is higher than 95% of the last 4 years. It's at one of the highest peaks, is what I'm trying to say. This is your favorite poo study. At least they brought back the red, like the alert us.
They did, red. But if you notice, like the very high is burgundy, which is known to be a calming color relative to the bright red. So the very high is us. We're in the very high. You would think, I mean, my gut says, oh my God, Texas is the worst. Alaska's looking pretty bad.
You're right. Oh, I wonder if that was intentional.
Of course it was. These are like.
Oh, gross.
Yeah, it's and
You're
then
totally right.
And gray seems like, well, I don't know. Why would you worry about gray?
What is gray?
Gray is literally neutral as a color.
No data. They have no data, so
there's no data there. So they don't have to worry because there's no data.
Yeah.
And I mean, it's kind of amazing that Florida is moderate. I'm sure that'll be used as like, oh, they didn't vax as much. And
it is
for us.
Really fascinating.
That you got to think there's some reporting bullshit going on there.
Well, that's the other thing. Like, if they can have all those states just not even report or not look at their wastewater, it really makes you wonder, like, maybe some of the more like, blue states are the ones who are slightly more aware and, reporting the data. I mean, I don't know, but anyway, it's just, that's not good.
But anyway, most of the map is the burgundy, which is very high, but it's not that alarming bright red in your face. It's that burgundy. So you're like, you don't read that as
so
holy fuck.
Yeah. Yeah. Cause it was like a deep purple, a deep red, like when before when they had like the spectrum that actually kind of made sense, right? It went from like green, which was good, like green is good, to deeper shades, but they were all like along the same palette in a way. So yeah, you're right. Yeah, they're never gonna
it would be like back. They used to have the daily death ticker.
Yeah.
And it was all as scary as you could possibly make the thing. Rightfully so. I mean, that's how you get people in tune with a pandemic they need to act differently in their lives for. And that went away. Yeah. But if that ever came back, it would be like, oh, we're in the green with only 1,000 deaths a day. Like that's where we want to be, is 1,000 people dying. Forget about how many people are actually disabled permanently. We're never going to get into that talk.
Right. No, although there was just that roundtable with the economist, and I can't remember his name, but he also worked with Larry Summers. I mean, not anybody, that you'd want to spend time with, but saying that there is no amount of money that's overdoing it when it comes to trying to deal with long COVID. It's a $16 trillion effort at least. Yeah. And that's care systems. It's, hospitals, nurses, beds, treatments. I mean, there are so many levels to what they're doing with this mass disabling, let it rip approach.
And this is what we keep repeating, or I keep repeating anyway, but that's where we sort of gain power as workers, unfortunately, but it's just the workers that are working. But I mean, because so many people are not in the workforce, and because the economy is going to be so impacted by all these COVID policies, we have incredible bargaining power, and the people that are working still should join unions like goddamn crazy. And unions should push to prosper policies for their employees that aren't even work related. Like, I mean, they are, but like healthcare, for example, if we get unions all pushing for Medicare for all, and they all join up together, and you have this push nationwide for Medicare for all, we'll get something close to Medicare for all, because they have to if we use our power.
Yeah. Yes. But that is going to be a difficult thing, because a lot of unions and the people who are members don't want to give up their health care as part of the bargain. I mean, you're right. There has to be a lot of
there's got to be a lot of convergence.
There's a lot of coordination between all the unions, or amongst all the unions. Yeah. And yeah, I mean, Audrey, you're right. Like, it's not like, oh, if we pull back all that military money or the cop money, they would then start funding, healthcare for everybody, or
no, absolutely.
Public college. It's not like a trade-off in that way, because that's not where they will ever want to put the money. But I do think it's just a really instructive way to show what the priorities are, right? Like, it's so clear that they are all about money and death, and that's all they care about.
Well, yeah, I think it impacts voters who don't necessarily understand the spending. Like, people always will say to me online, "Oh, you learn how politics works, blah, blah, blah." I'm like, I guarantee, even on a bill level, I know 10,000 times more than everyone who's ever said that to me online.
Yeah, I know.
Aside from that, politics works, and you can get what you want passed if you have, if you want to win elections, pass popular policies. That's not rocket science.
Yeah.
They have the money for all of it. Every single fucking thing you ever want to do, they have the money for.
And it would save money long term. Yeah.
But anyway, I don't know where else.
Yeah, and the thing with SAG had such great COVID policies at the beginning, like really fantastic. But Fran, the nanny, got rid of all of those. Just very sad. And yeah, Cora, I'm seeing what you wrote. I'm trying to read it all. We do not have the infrastructure right now because they defunded hospitals. They took away beds. They took away, like, everything is that just-in-time approach, which is why we didn't have masks or PPE. And remember, nurses were wearing garbage bags at the beginning, and they have not restocked up on that at all. Again, another place where Biden, yes, COVID, he was is horrible on COVID, but also just pandemic planning. What's going to happen when the next one comes, which is going to be, soon? We are not prepared.
Yeah. On COVID, so it's another one of those where the libs will fall back on, well, Trump was worse. Look what Trump did, blah, blah. I don't know if they paid attention to Biden criticizing Trump about, 200,000 dead people. If I was president, I'd kill myself, or, whatever he did say that.
Yeah. I'd resign. You shouldn't be president anymore.
I'd resign,
Yeah.
He clearly doesn't have a plan with 300,000 people dead.
Yeah. And here he is. So, yeah.
No, go ahead.
Well, they're projecting right now that in the next week, we will have 2 million infections a day, which means 100 million people total will likely get COVID. And we know that 10 to 20% of them will end up developing long COVID. But also, Fauci said that we will know that this is under control when we are under 10,000.
10,000 a day.
10,000 cases a day. And we're going to get to 2 million with vaccines. So, I'm sorry, but as bad as Trump was, like, he actually did his stupid Operation Warp Speed, and Biden entered office with the help of vaccines, which is not the cure-all. Even, I am, I don't know, 7 times vax now. It's ridiculous. I'm like a walking, petri dish, but like, I still mask everywhere I go. And they just let that go. And they said, well, we're going to let it go now so we can bring it back when we really need it. I don't know. Have we brought it back?
Right. So when these libs bring up, what can he do? They always point to, well, the Republicans killed the funding, blah, 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 blah. What can he do? Nobody wants to do it. It's bad politically if he does it. Well, even if he doesn't spend another dollar, if you message the importance of protecting yourself,
Yep.
people mask. All the data shows that if people think there's a risk, they take care of themselves. Yep. They're totally comfortable masking if there's a risk, but they just don't think there's a risk. And it's strategic that they don't. It's the Biden administration's strategy to undermine the importance and dangers of COVID. And
100%.
It's clear to anyone paying attention to all the people affected by long COVID, to all the people who lost loved ones to COVID. And unfortunately, it's not a big enough group that's aware of this. And this is where the fucking garbage left podcaster class comes into play, because these guys, think about how much Fauci was on the attention of everyone on the left. Oh, criticize, not Fauci. Well, do you think him saying we're going to have COVID under control when it's at 10,000 cases and we're at 2 million, is that newsworthy to inform your viewers that they might want to protect themselves? Because we're at 2 million. We're at, what's 10,000 into 2 million? It's way the fuck off. We're not anywhere near safe.
It's around the same size as your apartment. It's the 2.
Yeah, divide my apartment by.
Yeah. I mean, I don't really understand, because I don't think everybody who doesn't mention it is because they're getting financed by right-wing grifters. I don't think that could explain all of it. So I'm trying to understand, because it's a working class issue, it's a health issue, it's a economic, it's a racial justice issue. You see the number of Black and brown communities that have been affected astronomically, exponentially higher than white, wealthy people. And also white, wealthy people who, I mean, first of all, I'm kind of shocked. Again, it kind of reminds me of the billionaire submarine thing, where I kind of thought that wealthy people just didn't care about the rest of us while they were in their bunkers, and that's why they thought climate change would affect them or whatever. But one after another, they keep allowing themselves to get repeatedly infected with COVID. I really think even wealthy, privileged people don't seem to have a real understanding of how detrimental that is to their health and their chances of now of heart failure and cardiovascular disease. And
so my opinion when it comes to, I'm going to bring it back to the podcast.
Sorry. Yeah.
But it's both social pressure. So they want to be cool podcasters.
Right.
They don't want to be out of touch, unhip folks. Right. I mean, some want to go on Jimmy Dore. You have to be a right.
I mean, all those
friendly kind of crew, but that's a lot of podcasters that we know, that I personally know, which I don't want to get into beasts by name, but I know a lot of them personally.
Yeah.
And they just want to suck up to get on Jimmy Dore because it's going to make them more money for their show because they'll get more viewers.
Yeah.
I mean, I was on Jimmy's show and had 100,000 views or something, and if I had a podcast at the time, that would have made us a lot of money. If we had an actual podcast subscription model or something like that.
We're going to get there.
But take them out of the pictures. Let's forget about the grifters. It's just easy. They've fallen for the bias of normalization as much as anyone, because if you have cause to want things to be okay, which is natural for a lot of people just from being cooped up in their apartment or whatever, you want to do that. And then on top of that, your viewers, a lot of them are not believing COVID is real, or they think the vax is the problem. So you're I don't want to touch that. And then after a while, that's your audience, is the people that don't want to hear you talk about COVID.
Right. What are you trying to tell me? There should be so much more action, activism, direct action to keep ourselves healthy. And yes, clean air is the way to fix this. As I think it was Cora saying, we don't drink pond water, clean air. And it's not that expensive. It's actually it would be much less expensive than all of the deaf and disabled people we are now creating. But I guess it's, the other thing is, they don't want to
If
get sued for not providing for keeping it at the proper levels if they have to take care of indoor air. Although look at what they've done to the water. Nobody cares. Michigan got away with poisoning a whole generation. East Palestine, nobody gives a shit. Jackson, what is it? Jackson, Mississippi. Like, I mean, they poison the water all the time. So I don't know.
Yeah. I mean, look, the big business and neoliberalism and capitalism have won when it comes to COVID. Short term. Yeah. They have won big time. They have shut down any call for protections. You've got ICU units in hospitals not masking around babies.
I mean, that is absolutely grotesque. It is outrageous.
And this is where it really does matter that all these shows on the left don't cover this stuff, because the discourse isn't around. The discourse around COVID is just by the people who care about COVID a lot.
Right.
You know, and it should be just everybody. It should it should be the biggest criticism of Biden's administration before Palestine. It should be, especially that Medicare for all, most people saw as the top issue for Bernie's campaign, the big equalizer, separating healthcare from your job. And you're going to look at a pandemic and just ignore all the data and go, oh, we're out of the pandemic, so we don't need Medicare for all. Well, we need it, but let's just not tie it to an actual fucking plague.
Pandemic.
Let's just
plague,
ignore that part of it and pitch we need it because costs are too high or something.
Yeah. Yeah.
Like the opportunity missed is just astounding. And podcasters on the left direct a lot of the narrative on Twitter, at least.
Yeah.
Which trickles to real life. But there's a lot of power collectively, and collectively the group is fucking got no balls. They are not doing their research. They're a bunch of fucking cowards, and fuck them. But I want them to change their ways. I'm not saying all this to call them out and say, oh, we should have 10 million views on our show. I don't give a fuck if we never get 10 more viewers. But I want Crystal Ball to cover it. I want some of these bigger shows to cover it. I want RBN to cover it. I want it to be on every fucking podcast as a regular issue.
It really should be. I agree 100%, obviously. And it is a huge abdication of their duty, of what they should be doing. It's disgraceful. Now I'm trying to figure out who the former teacher podcaster is. I just had to put that up there because I can't figure it out.
Teacher podcaster.
Who? Oh yeah. Yeah, I don't know.
Stuck on that one. Tell me.
I know. I'm like going through my head.
Bree?
Well, I don't know. I don't think so. And actually, she just yesterday, I think, was talking about wearing masks and talking about COVID way more seriously than I've heard her in quite a while. It felt like maybe some of her friends have. I mean,
we're looking at Andrew Cuomo, getting pressure and covering on his stuff, long COVID, because he's had long COVID for 2 years or something.
Wait, Andrew or Chris?
Oh, Chris Cuomo. Chris. I mean, you got him. You got Peter Dow. Just today I tweeted something, but he's sharing the COVID data, saying this is ridiculous. How many of these podcasts on the left are to the right of Peter Dow on COVID? Like, if I ever thought a podcast was the right of Peter Dow in the past, that was the biggest pox on your house. Like, how fucking dare you? and most of these shows are criticizing Peter Dow still. They're like, oh, he's a flip flopper. Fine. I'm not into that argument. I don't care. But
at least
he's right on COVID before you. He cares more about people.
Yep.
He's criticizing the Biden administration more than fucking you fucking sackless piece of shit.
Yeah. It's disgraceful. It's disgraceful. All right. Do we have anything more on COVID before we keep up the joy? Damn it. 3 things. I got 3 things to say. As bad as the vax
cone
are,
off again. Sorry.
Oh my God, she's brilliant.
Toneless.
Sort of brilliant.
And knocked my beer over.
Is that what that noise was? She took her coat off. She was fixed today. As bad as or as ineffective as the vaccines are overall, they are still way better than not get. It's still way better to get it than not get it, right? So the blue bar is the percentage of school-age children, that's 5 to 17 years old, who are fully vaccinated by May 2023. And the orange is percent of excess deaths from disease in school-age children during the same time of the pandemic. So you see where, New York is really pretty amazing. They're at 58% fully vaxxed kids, school-age children. And they have, any excess death, they're at 0, I think. I can't even see it because I don't have my readers. Oh,
it says 0.
Yeah, 0. I know, it's just hard for me to see. Yeah. But then it just keeps on climbing as fewer and fewer of those same aged children are not vaccinated. I mean, what is that? 37% excess death? Geez, in Georgia.
Right. And this correlation, the number one thing it proves is that the vax is not what's causing all this harm in people. Like these idiots that are still claiming the vax is the harm. Sure, there are vaccine injuries and deaths. Right. That's just math. It's not good. And Big Pharma might lie about it. But science knows what happens now to your body in thousands of ways from COVID. And they're not saying, oh, there's 1,000 ways that the vax harms you. Every rational scientist is like, okay, yeah, there's a possibility that little thing, that little short-term injection of a virus, it's not a virus, but that short immune response evoked by the vaccine could kill you in some obscure cases. But it doesn't
actually
pales in comparison to the actual virus. If you're given if you think a little small glimmer of something that mimics a virus is going to harm you, think about what the fucking virus will do. And the math has always backed that up 1,000 fucking percent.
Yep. Yes. All right. What do you think?
COVID.
Time spent.
Okay, another study that shows mass work. I mean, it's just this is obvious.
98% reduction in the viral load.
Yeah, without fit testing and fit training. So just slapping on an N95, which, they make all this big hubbub about, fit testing, which I always thought was kind of probably likely nonsense. But,
I mean, I'm sure it's important, but yeah.
It's important, but, if you're breathing in and out, mostly through the filter,
it's going to be better than not. Yeah.
Particularly,
don't let the perfect be the enemy of the good.
Yeah. And particularly if you're in a short-term exposure situation, like you're going into a market, you're going to shop for 20 minutes, 30 minutes.
Yeah.
If you're working all day in the public, I would fit test the hell out of things because
for sure.
How much exposure you get to the virus, we also know matters. So
length
if you
of
are
time
exposed to a
and the
small
viral
amount,
load.
a small viral amount, which is, maybe you're going to get some of that if you're not fit tested as well.
Yeah.
Anyway, this is
wear a mask.
Basic, obvious shit that most people understand. There's just more and more evidence of it, and people saying otherwise, they're just talking out of their ass. They don't want to look at actual data or studies.
And just a reminder, we are about to have a heart failure pandemic. So wear a mask.
Yeah.